So I think one important piece that we're already seeing emerging from the process is that we have a very strong School of Medicine in Greater Cleveland, Case Western Reserve. And they realize the momentum behind the HIP Cuyahoga process. And they've been partners with us, but have now invested even deeper in the work that they do in the community with us, and have included the HIP Cuyahoga process in their new strategic plan for the university. So they now have said that this is a priority for us to work with the health department, help support around data, personnel. They have a prevention research center funded by CDC that works with us. So one of the things that's important now is they have to have a medical school see community health issues as a priority for them, and heretofore it wasn't stated as such in a strategic plan. I think is a big deal. And I think the fact that they now have weighed in has made clear to other partners in the community that this process is for real. And they're invested in it, and it has brought, I think, new people to the table, new partners that see now that the process is not a flash in the pan. It's real, and it will bear fruit over time.
And I also think it's enhanced collaborations, even both internally. Yeah. We're interacting as a staff in different ways that we hadn't normally interacted before, and we're starting to see bigger connections between our programs and the way that we're doing business, and it's also sparking innovation in how we can change our mindsets moving forward. And it's enhanced our partnerships externally as well, and as we continue, I think, to kind of change the thinking and move the momentum forward, I see that as a win-win as well.
Absolutely.
As a result of the CHOT process that we did, we are implementing the Community Health Improvement Plan. We're about 6 months in of implementation. We are seeing some change in our community. We definitely have a core group of folks who are committed to implementing the Community Health Improvement Plan. We also have some new folks on board, so we're continuing to foster those community collaborations and partnerships within our local public health system. The first thing that we've started implementing is really strengthening the information about different resources in our county. That was one of the goals in our Community Health Improvement Plan, one of the strategies, and that's the first one that we've started implementing. For that, we're already looking at current kind of resource guides and sources of information for local resources, and looking at how we can strengthen those, coming up with a lot of great ideas. And like I said, we have a lot of people on board, so I'm confident that those ideas will get implemented. We have a really robust plan, and it'll take 5 years to implement. And some things that we put in the plan have already kind of changed. We'll need to make adjustments as we go along. But I do see it being both a collaborative, ongoing process that will benefit the community in the long run. And I think next time we do it, around in 5 years or so, we'll have an even stronger product, and we'll have been able to show the community that we can implement change through this process.
As a result of our community health assessment and community health improvement planning, I can think of 3 things right off that have changed. One is that we are working together around collecting better data, because we saw the shortcomings of what was available. Many of us have wanted to get more data, especially around obesity and healthy weight, and we think that there are opportunities both within the WIC data, but also within electronic medical record data. And so because we have hospitals and health plans and public health, community clinics at the table, we have a different kind of a voice to ask for change, and so we see possibilities of change in that area. The second thing that's happened for us is that because of the new IRS ruling, the hospitals were planning by themselves, doing assessments by themselves. The health plans were supposed to be writing in Minnesota a collaboration plan, but they were kind of on their own to put that together. And we in local public health have our own requirements for assessment and planning. And so what's new is that we have this together, and we've agreed on certain areas of focus. And I think all of us feel we'll be more effective because of that. And the third area is in early childhood. And what we're doing there is sort of a long-standing issue we've had is that clinics and physicians are often doing screening of young people, developmental screening, seeing problems, but maybe not knowing exactly who in the community can help address some of the issues that they're identifying. The schools are feeling like they don't know how many young kids are getting screened and at what point, and they'd like to help. And so we've got some pilot projects now that are pulling together those entities because of this effort. And for the first time in 10 years, probably being able to move forward on kind of a chronic problem we've identified.
Well, we have been so excited about all of the successes we've had from our chaplainship. Several of our goals, one example of a success, we wanted to pass a countywide smoking ordinance, and which of course is recommended by all of our national strategies. And we set a goal date for that of 2015. But by having such great partnerships, and one of our strongest partners being our Deputy Judge Executive in Franklin County, Kentucky, Jennifer Wilson, we were able to get that done in 2012. We were able to get that done so easily, after hearing horror stories from other communities. It was amazing to me how easily that was accomplished. And one other huge success that we've had has been with a policy change in all of our elementary schools, which in our community is a county system, an independent school system, and 3 private schools. Every single one of their school boards passed a policy requiring every teacher to add at least 10 minutes of physical activity to every school day, incorporating it with the curriculum they already have. And so we were really excited to get that policy passed as well, and hope that that will ultimately help to reduce our childhood obesity problem.
Our health department is far stronger and more visible than it was 2.5 years ago. It's been a tremendous boost for us. Obesity is now clearly on the community radar screen, and I believe that everybody's poised to attack. We have dozens of new partners and resources at the table that we did not have a few years ago. An initial implementation of our CHIP is just a few months away. We're beginning to see a few success stories. In Cobb County, Public Health is now on the Strategic Planning Group for Transportation. And as I mentioned earlier, our Wellstar Health System recently completed their China, primarily using information from our MAP Steering Committee's assessments. Cobb County Chamber of Commerce now has a very active health committee, which is chaired by our Deputy Director. In Douglas County, several new partnerships between the faith-based organization, county government, and local hospitals will result in the August 2013 opening of a new community health center, which will primarily serve uninsured people below the age of 65.
Well, in spite of our challenges with implementation, one of our 4 counties that is in our health district, it's our most rural county, lowest population, used the data from the county level health needs assessment and the issues and the priorities that they set for their county to move forward with making some change in their communities. One of which was all of their school districts have gone to become tobacco-free campuses. And they're our only county out of 4 counties in northern Kentucky that have made that move, and that was an important step for them. They also used the data and the priority setting to create their own community collaborative around the issue of obesity prevention, and particularly childhood obesity. And they used the data from the assessments and looked at best practices to develop programming around obesity prevention. And they've done a lot of work, and the community is heavily invested in this coalition. And in addition, they use the information and the data to go on and apply for a number of different grants that have funded the work that they're doing. And they have been very successful and will continue to grow and be sustainable.
Well, from the standpoint, what will change through our improvement efforts, I believe the most glaring number that we would look at is health outcomes, a reduction in health disparities. That would take probably about a 3 or 4 year process before you actually see the evidence from it. But I think overall we will achieve that. We will begin to really address some of the gaps that's in the data and in the community. So if our rates of diabetes are high, or adult smoking, or binge drinking, I look forward to those numbers decreasing. I look forward to infant mortality decreasing in all neighborhoods, because we want to provide a playing level field and it to be fair and equitable. So I believe by collaboration, change will come, and that'll be the biggest improvement we see in the community.
As a result of our community health improvement process, I think training has become a key point for everyone. We realize that in order to make this work happen, you have to have some leadership skills. And it's not leadership as far as authority or leadership as in a position, but leadership is an act, and anyone can execute leadership. And so one of the things that we have local is the Kansas Leadership Center. And the Kansas Leadership Center actually awarded the Sedgwick County Health Department, along with the Visionary Wichita Health Alliance, $1 million in technical assistance support to train 400 people over 4 years in leadership around improving our health in our community. So they recognized our work, they recognized that this work was very important, that we had a very collaborative effort, that people were getting engaged, but they needed to stay engaged, and we needed to move people to do very difficult work, and that was going to take some leadership skills and some training, and so they offered that, and we accepted it.
Some of the things that we've done through the implementation of our community health assessment and our community health improvement plan, some of the outcomes we've seen include a complete streets policy. So we've passed one for the city of Billings, which was a long process, but very worthwhile, and we gained a lot of new partners in the process. Some of the other things we've done, we now have a community-wide health message. So we utilize 5210, which is 5 fruits or vegetables, 2 hours or less of screen time, 1 hour of physical activity, and 0 sugary beverages. And we've adopted this across all 3 healthcare organizations. Along with the schools have started to adopt it, the YMCA, and some other partners. And our goal really with that is just to have one message, make it easy to remember, make it a message everyone can know, so that it shows we're on board as a community with moving this forward.
I think a lot has changed as a result of the whole process. I think it was important for us that we used the MAP process because it has been so long. I think if we had just started and did the community health assessment or the community health improvement plan by themselves, they wouldn't be as useful. It would be more like, oh, we've got to get this done for accreditation. And we have sworn, the director, myself, our accreditation specialist, it's been important to us this whole time that it's not just a check in the box. It's not just a stepping stone to accreditation, that it actually means something, because it's a lot of work. It's a lot of mental work and physical work, and it's just really important that it means something other than just a piece of paper saying we're accredited. And so for us, it was important that it was embedded in the MAP process, and that it goes hand in hand with those 4 assessments that we've done, and that we'll continue to do those to really see if things have changed or not changed, and even if we have changed, and maybe understand how each agency works or interfaces, over time. And so that really has been one of the biggest benefits. And I'm glad we used the MAP process and that we were strategic in what we did. Now, in hindsight, going back to 2008 when we started this, I wish that we would have followed the MAP process better and actually looked at identifying strategic goals before we started doing the work, so that we kind of had an idea of where we wanted to be before we got there. It would be a lot less challenging. In hindsight, hindsight's always 20/20, but I'm glad we've done it the way we have. It's just we could have been more strategic from the get-go, but we will, in the second iteration.